Hi, I'm often asked what are the obstacles or what are the barriers to a good mental health treatment or a good psychological treatment for mental health, really. Now, obviously there are barriers because psychological problems are not diminishing despite tens of thousands, hundreds of thousands of people being involved in the profession of helping people. And of course, the pharmaceutical companies have been involved in developing drugs for many, many years. The problem of poor mental health is increasing. So there are barriers or obstacles. So I have a list of 6 that I think are really important. So the first one, number 1, is this. There's a poor understanding of what mental health problems actually are. Now, I'm not going to go into a huge amount of detail because I've got 6 points to cover, but let me give you an example. There's the common belief that, let's say, depression or even anxiety really are the result of a chemical imbalance in the brain. This is not true. But if you're told that and if you believe that, what can you do about a chemical imbalance in your brain? Well, you take an antidepressant, which is not very effective. So you're actually stuck. But what can you do about a chemical imbalance in your brain? Well, you can't do anything, can you? You could take a supplement, but it won't make a slight bit of difference. So there are a lot of myths and misconceptions about what mental health problems are, and I think that is a substantial barrier. Number 2, because the problem is so poorly defined, the treatment is so poorly defined, and there are in excess of 400 therapies. It's just psychological therapies, and then you've got all the pharmacotherapies, and then you've got all the alternative therapies. The whole thing is a complete and utter mess. If you define your problem in such a general way, depression, anxiety, then your treatment strategy is going to be general. You can't have a specific treatment strategy for a very general problem because it just doesn't happen. It just wouldn't make any sense. So the poor definition of the problem creates poorly defined treatment strategies. So number 3 is that treatments typically are not specific enough to deal with the problem. Now, we've said the problem is ill-defined, but now the treatment strategy is also ill-defined. An antidepressant, for instance, is not a defined treatment strategy. In fact, no medication is a defined treatment strategy for a mental health problem because the two are really quite disconnected. Or general counselling or even psychotherapy is not necessarily specific enough for the problem. Number 4, the treatment is unlikely to be collaborative enough. Now, I know that psychotherapists are always valuing the therapeutic relationship and even the collaborative nature of the relationship, but I swear to you that I've spoken to many hundreds of clients over the years. I'll say, okay, so what did you do in therapy? Well, I don't know. What kind of therapy was it? I don't really know. What was useful to you? Well, I'm not sure. Right? There's no genuine collaboration. You, as an individual who, let's say, is seeking some help for a psychological problem, you are the repository of masses of strengths and resources that can be brought to bear on that problem. But if you don't know what you're working on, if you don't actually specifically know what you're trying to achieve, how can all of your healing resources, your natural healing resources, be applied to the problem? So in a sense, it's a treatment strategy is applied to you, but like a sticking plaster on a wound. And you might not know the nature of the wound, but you've got a sticking plaster on it. So I think this lack of collaborativeness, this lack of collaboration between the therapist and the client, irrespective of what the therapist says, if you don't know what you're working on, if you don't know why you're doing it, and if it's not targeted on something that you find meaningful, that's not collaborative. Number 5 is that I think progress is not adequately measured and recorded. Every client that I would have, we will use questionnaires to define at least symptom clusters, so we could say, okay, this is where you are. And we might say, well, the severity of the problem is this. And we measure that over time. And then we can kind of go, okay, this is good, this is not working, this needs to be changed. But we're measuring it. We're turning it into something that the client also has some ownership over because they're interested in their outcome and they can see progress. Because actually, it's the way memory works, it's very hard to remember where you were if you're feeling better. And it's always good, therefore, to apply some measuring tools so that we're accountable for progress. And number 6, I think there's a poor use of homework. There are 168 hours in the week. You typically have therapy for 1 hour. That leaves 167 other hours. Now, obviously, you're asleep and whatnot. But what are you going to do in that 167 other hours to change your life in the way that you wanted to go? And so, homeworks, tools that you use, things that you practice repetitively, things that you practice with an understanding of why you're doing it to make changes that you can experience, that's the proper use of homework. And I think in general, certainly if you take an antidepressant, there's no homework at all, other than remember to take the antidepressant. And a lot of times in counselling and psychotherapy, there's a poor use of homework. And if you're not using the other 167 hours, well, I think you're definitely missing a big element of what a treatment strategy would look like. And that's got to be a barrier. So these are, I think, the 6 biggest barriers to what we might think of as an effective, personalised psychological treatment strategy. If you want to know more about personalised psychological treatment, please visit drpurves.com and see this new approach that I've pioneered. And I think you'll be pleasantly surprised to see just how much progress you can make with a focused, unique and targeted assessment and treatment strategy to solve the problems that you struggle with.